Hey, this is Alan Banks with GuidedSMILE, and I want to talk about a hard rule about bone reduction that we have. And the hard rule is maybe not so much for you, but it's for us, because our rule has to do with how we make our surgical guides. And I've seen out in the marketplace where guides are made with all different kinds of indicators to where you stop producing bone. In fact, I saw one recently where there is a tissue cut guide that goes all the way up the ramus, or goes over the hamate or notch. And it has this very long, extensive flap required to seat their bone-supported guide, right? Well, that might make sense if you have a guide that's sitting on the bone. Maybe for some reason you have to get it way in the back of the mouth because your system, your prosthetic, your philosophy has to do with how you ramp the bone or how you extend the bone reduction way back in the mouth. And for us, doesn't really make any sense. You really need to leave it up to you to how you want to ramp the bone past the last implant. So with that, we made our philosophy, which is backed up by many KOLs and years of making these guides. And that is that distal to the terminal site, 10 millimeters. That's our rule. So you take the center of the terminal site in our software, it will automatically go 10 millimeters distal to that, and that is where our cutoff is of our metal, right? Both sides, bilaterally, our metal is automatically cut off there. And because it's a labial-only fixation base or bone reduction guide, then you'll know that when you get to that point at 10 millimeters, that's when you can do your ramping. Maybe a little before it, but right around there is where you'll ramp up. And that way the distal extension of the prosthesis will have, the way we design it, will have space for tissue, and then it'll be designed so that you have your ramping right below it. There is no reason, in our opinion, to just keep making a guide extend back to guide you some bone reduction that's way beyond the terminal site of a prosthesis, right? You're probably gonna have a molar, and you're probably gonna have a limited cantilever off of that. So the surgical prosthesis is not gonna go that far back. The rapid appliance and the final will both go that far back, as far as 10 millimeters past the terminal site. So that's the rule. That's why you'll see our fixation bases stop where they do in relation to the terminal of the implant. So there you go, little nugget for the day.